Okay, so cyanogenic glycosides, what that basically means is you have basically cyanide, which is a toxic gas with a sugar molecule attached to it. And cyanogenic glycosides, they're found in a number of different plants. And so they tend to have like an almond-like smell to it. And so when you think of things like when you grow up, when you're a kid, people said, don't eat the apple seeds, they contain cyanide. That's actually true. Almonds also have it, apple seeds, peach apricot seeds. These are members of the Rosaceae family, and they tend to have small amounts of cyanide in it. Some other examples of this is wild cherry bark contains it in it, so it acts as a cough suppressant. Also, elderflower and elderberry, the leaves of the plant, tend to have little bits of cyanide in it. And there are other vegetables that also contain it in. So if you look at cassava, for example, this is probably next to rice and wheat. It's going to be the most commonly used type of starch. This is what tapioca is derived from. And it contains cyanogenic glycosides. And the way they process it is they basically cut this up, let it sit for hours to allow an enzyme that basically helps to release the cyanide from it so it becomes less toxic. But under certain situation, what can happen if it's not being properly made, or if they use plants that have higher amounts of the cyanogenic glycosides in it, that people can develop a disease called conso, which is a paralytic disease when people are consuming high amounts of bitter cassava. And this might actually happen in areas in Africa where there's droughts. And basically, the cyanogenic glycoside starts knocking out the mitochondria, and the nerves are primarily the first place that are affected. And so, if you look at the main toxicities associated with it, is that one, it interacts with iodine, so it basically displaces iodine, and chronic long-term consumption of cyanogenic glycosides could increase the risk for goiters. And then the second thing that happens, because it's knocking out the mitochondria in the body, this ends up causing neurological problems like difficulties walking, paralysis, various types of pains, heart problems, and even death. So just as a side note, when you buy certain types of B12, it'll say cyanocobalamin. And basically cyanocobalamin means that the hydrogen cyanide is bound to the B12 molecule. And it's not really in high amounts. Like a little bit of cyanide is not going to kill you. Well, parts per million would, but less than that it won't. There's different forms of B12. So hydroxycobalamin and methylcobalamin. The methylcobalamin is the active form. That's the one I usually give to patients. But there's one called hydroxycobalamin that it will readily bind up cyanide if it was in your body. So it's actually maybe the antidote for hydrogen cyanide poisoning if somebody was exposed to that. So the take-home message, careful with these things. You don't want to consume a lot of things like wild cherry bark or other herbs that really have high amounts of these cyanogenic glycosides, because they're not good for you. Now, one of the things when it comes to herbal medicine that I'm usually pretty careful about is drug interactions. I think the way I look at drug interactions is, if somebody's on a particular medication, what would be the worst case scenario in my mind if I were to either double or half the dose of what they're on? Or what would happen if the herb I gave increased the effects of it because it kind of worked on the same sort of mechanism? And based on that, then I kind of make a decision on whether it's safe to give to the patient or not. So with drug interactions, there's a lot of different ways that herbs and herbal products could interact with medications that people are on. There's a good book called Francis Brinker. He's an ND. Doesn't really practice, I don't think, but he's a good researcher and he's done lots for the profession. I recommend this particular book by him. It's on my shelf. I've looked at it lots in the past just to kind of get a rough idea of whether there could be potentially some interactions. The problem is I would say that most herbs will interact or have the potential to interact. Whether it's clinically significant or not, sometimes it's hard to say, but there are a few things you want to watch out for. So already we've mentioned a few of these ideas. Certain herbs could decrease the absorption of drugs by either in the form of fiber or tannins, by binding it up or inhibiting the absorption of it or affecting the mucous membranes and the absorption that way. Certain herbs could decrease the efficacy of certain drugs. So St. John's wort, if you remember, it stimulates phase 1 liver detox, and that would decrease drug levels. So if someone was taking antiviral drugs for HIV, that could decrease the effects. You could also have certain herbs could increase the toxicity of drugs. And so one of the concerns is because grapefruit juice inhibits phase 1 detox, then what it basically is doing is it's increasing drug levels of certain things like statin drugs in the body. And so grapefruit juice, if someone was on a really high level, high dose of statins, like the maximum dose, and they took grapefruit juice, you could increase the risk of getting some of the toxic side effects from grapefruit juice, which would be muscle wasting and some other issues. So that's another way. Now, there are some positive drug interactions that also occur, though, is that in some cases herbs can decrease the negative effects of drugs. And so there's a number of studies that show that things like ginseng and other herbs and even milk thistle could actually decrease the side effects. So if, let's say, chemotherapy, fatigue is a side effect, then ginseng can help counteract that. Or if immunosuppression is a side effect, ginseng or astragalus or Siberian ginseng could all do that. So there's positive effects that you can get when you combine herbs with drugs. It's not always negative. Often, I would say doctors just assume that there's going to be a negative effect because there's no benefits from taking herbs, but there's a lot of positive effects that can happen by decreasing side effects. And then I also think there's the potential to increase the efficacy of drugs. And so there's research that shows that anti-inflammatory drugs, when they're combined with turmeric, for example, it can decrease the dose of the drugs that someone needs to take. So if you are at risk of getting, taking too much ibuprofen or Tylenol, then taking some herbal anti-inflammatories could decrease the dose of those other drugs you can take and decrease the risk of getting ulcers, also decrease the risk of getting, liver problems. So lots of different things worth looking at. A couple interactions of some dangerous interactions that should be mentioned is when people are on antidepressant drugs, many of these antidepressant drugs work by elevating serotonin levels in the body. And so there are things like selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors, tricyclic antidepressants, and monoamine oxidase inhibitors. All 4 of these different classes of antidepressants, and these aren't all of them, but all these basically elevate serotonin in the body. Now the concern is that if you were to combine several things that could enhance serotonin levels or work synergistically to boost up serotonin levels, this may actually be a dangerous thing. And we know that, for example, 2 herbs, rhodiola and St. John's wort, these both may affect these different enzymes in the body. And so monoamine oxidase enzyme is affected potentially by roseroot. St. John's wort can affect a whole bunch of different things in the body. And so if you were to combine, let's say, a SSRI, an antidepressant drug, and someone's like, I'm still feeling depressed. I've already increased my dose of the drug a few times, so I'm going to try to combine, let's say, St. John's wort with it and see what happens. This could cause a dangerous elevation of serotonin. And in the case of serotonin, unlike dopamine, if you do get too much serotonin, you can suffer from something called serotonin syndrome. And serotonin doesn't just involve mood, but it's also involved with thermoregulation in the body. It also is involved with stimulating the gastrointestinal tract. It can cause hallucinations. It can affect your blood vessel constriction and dilation. And so when someone gets excess amounts of serotonin, what can end up happening is they get basically this euphoric, manic-like state that may become, start suffering from hallucinations and confusion. So this would almost be like a drug overdose if somebody were taking a mixture of let's say, ecstasy, the drug, and ayahuasca, or LSD or magic mushrooms. They start getting all excited, euphoric, maybe manic, confused, acting odd. They might start to overheat as well. They may be suffering like the nausea and vomiting, diarrhea could be happening with it, muscle twitching and increased hyper reflexes. And then finally, it can have a negative effect on the cardiovascular system, causing increased heart rate and increased blood pressure. And so people have died from an overdose of too much serotonin in the system. And this can occur if you combine one or more antidepressants. So if you take an SSRI drug and combine it with a monoamine oxidase inhibitor drug, that could be fatal. Now, another thing, just as a thought, if somebody, if there's someone who is suffering from depression and they went down to the Amazon because they wanted to take ayahuasca, but they were taking a bunch of antidepressant medications and they decided to take ayahuasca, that interaction could potentially be dangerous, in my opinion, because we know ayahuasca contains a monoamine oxidase inhibitor. So combining that with some antidepressant drugs, that could be dangerous. So otherwise, roseroot, or everyone calls it rhodiola, and St. John's wort are generally very, very safe plants to take for depression, but not safe if someone's taking a drug that interacts with serotonin. Now, there are other antidepressants that don't affect serotonin. They work on norepinephrine or dopamine, and combining St. John's wort with those may not be a problem. But in general, I'm usually very cautious if people are on mind-altering drugs to start adding herbs to it. Another serious interaction that people could you might encounter is that people are on blood thinners like Coumadin, or also called warfarin. This is a serious drug that's used to prevent blood clots, and if you start altering the bleeding time, so if you were to basically potentiate it and thin the blood too much, then you have a risk of getting like serious bruising going on, or even like hemorrhagic stroke. So you don't want to potentiate or have a synergistic effect by adding herbs that can make the blood thinners work too much. But also, if someone's at risk of having blood clots forming because they have a artificial valve, or they maybe have a history of a stroke or some other condition, then you don't want to give drugs that will basically decrease or make the blood kind of work against the blood thinner, because then there could be an increased risk of getting some kind of blood clot in the body. So you don't need to memorize these for the example. Just appreciate that there are herbs like garlic, ginger, ginkgo, feverfew, dong quai, willow bark. All these things have a blood thinning effect. So if you were to combine these with Coumadin therapy, that could basically increase the risk for bleeding. And then there are other drugs or other supplements and herbs like ginseng, vitamin K. Yes, it's a supplement, but you also get in green tea, kale, leafy greens. I'm sure there's lots of green leafy herbs that probably also have it. St. John's wort, all these can potentially decrease the efficacy of warfarin, and that could be problematic as well. Just as an aside, you don't need to know this for the exam. I'm just showing you this to appreciate that there are different enzymes in the body that are involved with the clotting, various clotting factors. And so if we look, the ginkgo inhibits an receptor called platelet activating factor. That's how it acts as a blood thinner. Willow bark and other salicylic acid containing herbs work on the enzyme called cyclooxygenase 1. And so it inhibits that enzyme to have its basically blood thinning effects. And ginger then works on a totally different one called thromboxane synthetase. And why I think this is interesting is just appreciate that herbs can work by multiple different mechanisms. And I would imagine that maybe willow bark and Coumadin alone, that might probably that would have some effect. But if you were to give someone some extract that contained willow bark and ginger for, let's say, to decrease inflammation from arthritis, and they're also taking ginkgo for their memory because they're older, if they're taking all three of these and they're on Coumadin, that could be a really, really serious drug interaction because it's working by different mechanisms. And usually, in my opinion, if it works by multiple mechanisms, there's more likely to have some kind of synergistic effect there. So there's willow bark on the left, garlic on the right. Garlic also has blood thinning effects. One other thing that's worth mentioning is that there are different coumarins that are found in herbal medicine. They don't directly act as a blood thinner, but potentially, if you don't store your herbs properly, like we described earlier, if a fungus contaminates your red clover extracts, let's say, and it starts to ferment some of the active compounds, it can form things like dicoumarins, which may have some blood thinning effects. So vitamin K is on the right-hand side, and coumarin and warfarin, just different pictures. I like the chemical structures. It helps me understand what's going on with these plants. A couple other miscellaneous concerns for drug interactions. In Japan and Kenpo medicine, there is a formula called Shosakoto, which is also referred to as minor bupleurum formula in Chinese medicine. This is a great formula that they use for hepatitis C infections, and it's been shown to have a lot of beneficial effects to decrease the risk of fibrosis and liver cancer. But the conventional treatment for hepatitis C is to give interferon treatment. And if you have a patient who's taking interferon treatment and they want to take this SST formula, the research shows that it could cause a serious life-threatening type of pneumonitis, which is inflammation of the lungs, and cause other health problems. So this is an interaction where it's not something I would have predicted, but apparently it stimulates some kind of inflammatory response when you combine the two together. So people who've got hepatitis on interferon therapy, you can't give that to. If they're not on it, I would recommend looking into this. This has got some good research for it. Final few more things. When it comes to pregnancy, there's a few things that you want to watch out for. Certain herbs are known to have some actions that could be damaging to a fetus. So teratogenic, basically this action means something that causes harm to a developing fetus. So terato means monsterogenic, means to form. So basically you're forming little monsters if you take a teratogen. That's what the actual translation means. And so you're likely to get some kind of mutation which can be toxic. An abortifacient is a herb that stimulates uterine contractions to terminate the pregnancy. It could do that either by stimulating the uterine contractions, or it could also do that just by directly damaging and causing harm to the fetus. Amenogogs, these are herbal actions usually used to stimulate uterine contractions or to help with when people have amenorrhea, they don't have a period, or even help with certain types of menstrual conditions. Basically what it does is stimulates the menstrual flow, and the concern with that is if you're stimulating the uterus, it could have an abortifacient effect, so it's not recommended. Now another thing that's often used for pregnancy is something called a parturient, or Partus preparatus, and that basically means it's given to women who are pregnant to help assist with childbirth and delivery. But not all these are appropriate to give to pregnant women. For example, the story of blue cohosh, it was used by First Nations people in North America to help in the third trimester, to help with delivery of the fetus, of the baby. My concern with that is there's been several case reports that have been published saying that blue cohosh, when given by midwives to pregnant women, it's increased the risk of having certain type of heart conditions, and so I wouldn't recommend it. And because of that, basically there's warnings out saying that it should not be taken during pregnancy. I think that probably traditionally it was used in the third trimester in relatively small amounts. Maybe it was safe, or you had to weigh the risk versus benefit on it. If there was the concern of some kind of issues, or if there was maybe a delay in the woman's gone over, maybe it makes sense to give blue cohosh. I certainly wouldn't be giving it prophylactically to women, and I would explain to them the risks of taking blue cohosh, just so that if anything bad happens, I wouldn't get sued. So would I use it in practice? I might, but rarely, just because of the safety concerns. There's a good book that was published by a good friend of mine and colleague, Dr. J.J. Dubois. He's an a naturopath who graduated in my class, and he's a great guy. And he wrote a book. He did his PhD after he finished his got his MD, and he did most of his research or all his research in safety of herbal medicine and supplements in pregnancy and lactation. And they published a book a while ago. This book's expensive, hard to find, it's out of date now. But what I like about it is that they did a systematic review looking at a lot of the herbs to sort of evaluate whether they're safe, unsafe, should be used with caution, or what. And just some common herbs, just you don't have to memorize this, I'm just letting you know. These are great charts. The summary is basically these are a number of herbs that were safe to use during pregnancy. Things like cranberry, echinacea, garlic, ginger, horse chestnut, ginseng, milk thistle, peppermint, raspberry, turmeric. You can look at the whole list there. I like this list because based on this book, I could use these in private practice and feel very comfortable using it. So if someone had varicose veins, you could use horse chestnut. If someone had nausea and vomiting, you could use ginger. If someone had a cold, you could use garlic extracts, or you could use echinacea. If somebody was suffering from depression, then technically speaking, St. John's wort could be used by them. So there's just a few examples of herbs that are considered to be safe because they've looked at the research enough that they've established it's safe. It's not my opinion, it's the opinion of people who have evaluated the evidence. So, you know, just because some naturopath says that blue cohosh is safe to give during pregnancy doesn't mean I want to use it. These are a bunch of herbs that they said should be used with caution. And so if you look at the list here, coffee, for example, should be used with caution because you don't want to drink too much coffee if you're pregnant. Green tea you have to be careful with. Other things that you might suspect should be okay. Flax. So if you had a lot of flaxseed, you're adding, you're having flaxseed muffin. If you had one here and there during your pregnancy, probably not a big deal. If you're eating flax like 3 times a day, it might be an issue. And I think the caution here is that we just don't know because maybe the research hasn't been done. With coffee, we know that 1 or 2 cups a day is safe during pregnancy, but if you have more than 5 per day during the pregnancy, it increases the risk of a number of different complications. So a little bit's okay. Too much is not good. And most things follow that. Like a little bit might be okay, but you got to be careful with how much you use. So that's on the list of things that should be used with caution. And then the herbs that we know are unsafe, and I wouldn't bother using them. Things like barberry, golden seal, Oregon grape. These are all those antimicrobials that we talked about in one of the synergy lectures. Don't want to use these during pregnancy. Borage contains pure lysine alkaloids. Those aren't really safe to be used during pregnancy. Certain essential oils from juniper, calamus, parsley, pennyroyal. Those are things that I wouldn't want to use during pregnancy. A little bit of parsley in your tabbouleh, if you ate that, I don't think you're going to have a miscarriage. But if you were taking high doses of parsley, like eating a cup of it a day to treat a urinary tract infection, that wouldn't be a good thing. Generally speaking, anything that says deadly in front of it, you probably shouldn't use during pregnancy. So deadly nightshade, I wouldn't want to use that. We discussed that one. All right, ephedra, that can have some issues. So, again, these are dose dependent. If you had one cold and sinus medication, would it cause problems to the fetus? Not likely, but it's still probably unsafe. I wouldn't mess around with those guys. Foxglove, and again, they've basically said that blue cohosh is considered to be unsafe during pregnancy when you look at the research. I want to emphasize that there are lots of naturopaths and midwives that do use blue cohosh during pregnancy. I don't know if it's a good thing or a bad thing, but all I know is if they're saying it's unsafe, if anything happened to that fetus and you gave that to a pregnant woman without explaining to them that it's considered to be unsafe, and the baby was born with some heart issue, you could have a lawsuit. People go crazy when babies get hurt or injured. So you really would have to weigh the pros versus the cons of taking blue cohosh during pregnancy and explain to your patient the risks with it. So that's my daughter. I don't think she's got 2 months. It's a funny little thing. So my opinion on pregnancy and lactation, I always err on the side of if we don't know, I don't really want to take the risk, especially because it's just not worth it for me. The risks I would take on myself is different than the risks I would want to take with my patients' unborn children. So if you're ever uncertain, just avoid it. It's just not worth it, in my opinion. There are some herbs like blue cohosh that were traditionally used during pregnancy to help with delivery, but they've been kind of shown to cause harm to babies. So, I don't know if it's wise to use that. There's a number of different phytochemical classes that are unsafe. Isoquinoline alkaloids, pyrrolizidine alkaloids, quinolizidine alkaloids, tropane alkaloids, protoalkaloids, anything, mostly alkaloids I wouldn't mess around with. A number of the essential oils I'd be very careful with during pregnancy as well. Even oregano, I'm not convinced it's safe in high amounts to be used during pregnancy. If you took a little bit for a cold or a flu, probably not a big deal, but I just don't know. So I'd rather not use it. Cardiac glycosides, I wouldn't use those anyways on most patients. So the summary is, when in doubt, don't use it. And if you do end up using something, you have to explain to your patient that either there are risks or we just don't know. Do you guys have any questions? Anybody still there? No questions? Okay, so that's it. If you guys have any questions, let me know. I'm going to post some sample questions on Moodle for you guys. That'll give you a rough idea. I'll do a little exam explanation on Moodle for you guys, and that should help with the study. So I hope you guys have a great Thanksgiving and a great exam week. If you have any questions, ask them on the discussion forums on Moodle, and I'll answer it so that everybody sees the answers. Okay? Take care. Talk to you soon.